Hello, I am Dr. Rajeev Gadgil, and today in this small presentation, I am going to elaborate a very important aspect of oral radiological interpretation, that is lamina dura, as seen in intraoral periapical radiograph. Lamina means layer and dura is white. That means lamina dura is a thick cortical bone lining the socket, which gives a radio-opaque appearance as shown by red arrow. The lining bone is thick but not more mineralized. It looks more radio-opaque as X-ray beam has to pass through the entire length. As you can see in this radiograph, a red arrow marks the radiopaque lamina dura which runs all around the tooth. This radiograph illustrates an extraction socket in the anterior region and the radiopaque lamina dura is seen, which suggests that lamina dura is part of the bone and not of the tooth. Same appearance you can see in molar region in this posterior radiograph. Now let us see what are the reasons for getting variation in the width of the lamina dura. This slide is a schematic diagram to explain radiopaque projections of lamina dura. Figure A shows length of the compact bone with X-rays passing through long axis resulting in narrow but sharp and dense white shadow. In B, the length through which X-rays have to pass is much longer, so shadow is more dense and radiopaque. In figure C, same length of bone as in B but slightly angulated, so X-rays have to pass through less thickness but more area, so the laminate image is wide but less radiopaque. And lastly, in D, cross-section of the lower incisor socket is shown where mesial and distal margins are equal. So narrow sharp shadow seen same on the both sides. Here in figure E, it is showing a cross-section of a canine where left hand line is long and straight, producing a dense white and narrow shadow, whereas the opposite right side border is convex and the rays only pass through the summit, producing a shadow with poor definition. In F, transverse section of lamina dura of a molar showing that mesial and distal borders are curved and unequal, so neither shadows are sharp due to curvature of dense bone. Figure G shows transverse section of a bicuspid. So because of the curvature, two shadows are cast on left hand side and one on the right hand side. Lastly, in figure H shows a dumbbell shaped anterior socket of a lower first molar. Three or more shadows may be projected of the lamina dura. As explained in the previous slide, a radiograph of lower molar where mesial root is showing three lamina duras shadows marked by red arrows. Corresponding PDL spaces shown by yellow arrow may be mistaken for accessory canal or roots. Now this is an important slide as we are talking about clinical importance of lamina dura in diagnosis. In the incisor, the yellow arrow shows breach in continuity of the lamina dura, suggesting that the root apex is denuded of bone due to pathology. This suggests non-vitality of the tooth. But in molar radiograph, the breach in continuity shown by yellow arrows doesn't show pathosis but a developing root with papilla, and so lamina dura is not continuous though the tooth may be vital. Broad lamina dura as depicted by yellow arrows doesn't indicate sclerosis, as it is not possible that only lamina dura will get sclerosed and not the surrounding bone. Though the lamina dura is continuous around the tooth radiologically, anatomical foramina perforate them, but not seen as they are too small to cast a shadow. In slender roots, bone density around it is so thin that it is unable to cast a shadow. In these cases, lamina dura appears to be absent but must be confirmed by clinical vitality test before rushing to the diagnosis. Lamina dura may not be visible in rotated teeth, especially in presence of developing teeth. Localized absence may be seen in cases of migrated teeth also. Now this is a very important slide for students as normally a question is asked about absence of lamina dura. So on your left hand side, the lesions such as hyperparathyroidism, osteomalacia, rickets, oxalosis, Cushing's disease, histiocytosis X, leukemia, and multiple myeloma. These lesions show generalized absence of lamina dura, whereas on your right hand side, conditions like osteoporosis, osteopetrosis, Paget disease, fibroid dysplasia, and ossifying fibroma shows obliteration of the lamina dura. To end this video, I will like to give you some suggestions. You should always use a magnifying glass with a good quality viewer to find pathology and differentiate from normal anatomic appearances. One should have a thorough clinical knowledge to arrive at a diagnosis. Intraoral periapical radiograph is the best and cheapest way to detect small lesions as resolution power is good. Thanks for patient viewing. In the next video, I will be explaining about periodontal ligament space. Do subscribe to this channel for more updates. Thank you.